It is a cancer that thousands of women face every year. So what are the risk factors? How is it detected? How are screenings such a key tool in prevention? We're going to talk about it all with Dr. Yasmin Lyons, gynecologic oncologist from the Mays Cancer Center at UT Health San Antonio's MD Anderson Cancer Center. We are talking about cervical cancer. January is a month to really raise awareness about that. So let's first start with the risk factors. What are the risks when you're talking about this disease?
So, by far the biggest risk for cervical cancer is going to be infection with HPV, or the human papillomavirus. Because HPV is a sexually transmitted infection, most of the risk factors have to do with that. And those risk factors are early age of sexual activity, multiple sexual partners, having a partner with multiple partners, and having other sexually transmitted infections. There are some risk factors that are not related to HPV, and that includes smoking and having a weak immune system.
So, I don't know that a lot of people know a lot about cervical cancer, which is one of the reasons we wanted to have you on, doctor, and I appreciate it. It's the fourth most diagnosed cancer in the world. 13,000 women will be diagnosed in the United States this year. 4,000 women will die from it. Give us some of the symptoms that really people shouldn't ignore when it comes to cervical cancer.
Yep. So, the biggest symptoms are probably going to be abnormal bleeding. So that could be absence of a period, as well as really heavy bleeding, bleeding in between periods, and bleeding after sex. Other common symptoms include vaginal discharge, back pain, fatigue, and bleeding from the bladder or the rectum.
How is it detected? How do you detect cervical cancer?
So the best way that we can try and screen for it is through a pap smear, and that is assuming that it's a really early cervical cancer. So the best way that women can prevent cervical cancer is by getting the HPV vaccine and then doing their screening for cervical cancer with pap smears every 3 years if they're between ages 20 through 29, and every 5 years, along with HPV testing for women who are 30 to 65.
When is the HPV vaccine normally given?
So the HPV vaccine is approved all the way from ages 9 through now up to age 45, and for both men and women.
I think there's also a lot of misconceptions just about what HPV is, who can get it, how it's treated. What are some of the biggest misconceptions that you run into when it comes to HPV?
Yep, I think a big myth that we run into a lot is that only women can get HPV, and that is incorrect. So men can get HPV, they do, and it causes other types of cancer in men, just like it causes cervical cancer in women. Another big myth is that people say if they've had their HPV vaccine that they don't need pap smears, and that's incorrect, because we do have some cervical cancers that are not related to HPV. So that's why the pap smear is so important in addition to the HPV vaccine.
What are some of the treatment options for people that are out there that are suffering from cervical cancer?
It really depends on the stage of the cancer, meaning how far it's spread. For a really early cancer that's just limited to the cervix, we can offer patients surgery. For those cancers that have spread past the cervix but are still in the pelvis, we can offer a combination of chemotherapy and radiation. And then for patients that have distant disease, meaning that it's spread from the cervix to other places like the lung or the liver, we can offer a combination of chemotherapy and sometimes immunotherapy.
You mentioned this earlier when it came to pap smears, but keeping track of the timing with your pap smears, with your mammograms, the recommendations have changed over the years. So I want you to go back and tell us again, how often are women supposed to be getting these routine screenings, and does it depend on your age?
Yes, it definitely depends on your age. For women that are ages 21 through 29, we just recommend a pap smear and no HPV testing, and that is to be done every 3 years. And then for women ages 30 through 65, we recommend both a pap smear and HPV testing, and that's going to be given every 5 years.
So you said that women should not ignore some of the symptoms that we listed earlier. What's the very first thing someone should do if they have some of these symptoms, if they are concerned that they may have cervical cancer?
So if they have any of the symptoms that we experience, they should talk to their OBGYN. If the OBGYN then thinks that it's concerning for cancer, they would get sent to a gynecologic oncologist who could help treat them.
I was asking you earlier before we got this segment started if family history played a role. You said it's really not that significant when it comes to cervical cancer. And given the risk factors that you listed, would you say that this is a preventable disease with these routine screenings?
I would say it's one that is preventable now with the HPV vaccine and with early detection by routine pap smears.
So for men, you said HPV can cause different types of cancers in men. Give me an example of what type of cancers HPV can cause in men.
So for men, HPV can cause anal cancer and it can cause oropharyngeal cancers. Same thing in women. It can cause anal cancer and oropharyngeal cancers in women too. Obviously, men can't get cervical cancer, but they are still at risk if they have the HPV virus to, that it can turn into a cancer.
I'm going to ask you something. Some people might think it's a silly question, but I'm guessing there's a lot of people out there, whether they're willing to admit it or not, don't know the answer. And I'm not just talking about men. What exactly is a cervix?
Yeah, great question. So the cervix is the very bottommost part of the uterus, and most people think about it in the setting of childbirth because the cervix is kind of the exit or the last step before a baby is born. The cervix is what dilates. So that's the only part of the internal female genitalia that we can see on a pelvic exam.
Dr. Yasmin Lyons with UT Health San Antonio, appreciate your time. I appreciate Myra for not putting me on the spot there with that, quizzing me on what a cervix is. So we appreciate you going through what is very important information on cervical cancer.
You bet.
Thank you for having me.
Yeah, thanks for being here.
Keep up to date with all of San Antonio's top news, weather, and so much more by clicking the like and subscribe buttons below. And once again, thanks for watching KSAT.